dull, left. Hi, Nicole. My name is Dr. Matt. I'm going to do your exam today. So go ahead and tell me a little bit about what's happening. Why are you here?
Well, I've had a really stuffy nose, and I've been getting these ear pains. It's ringing, and a little bit of a headache.
Okay. So headaches, ringing in the ears. Is that in both or just one?
I would say it's mostly in this left ear, but it's a little bit in the right as well.
Okay. So left ear. And pain. On a scale of 0 to 10, how would you rate your pain right now?
4.
And how would you describe it? Is it achy, dull?
Achy.
Okay. What about headaches? Are they localized in the front or they move more towards the back?
It's in the front.
Okay. Are you taking any medications?
No.
Okay. Can you please verify your date of birth for me?
February 3rd, 2002.
Okay. Do you have any allergies? Okay. And what's your approximate height and weight?
I'm 5'4". I weigh 100 pounds.
Okay. This is just so we know how to dose your medication if we end up prescribing anything today. Okay. So you said you're not taking any medications. You've been having these headaches for how long now?
Past 2 days.
Okay. Ringing in the ears, pain. Are you having any sore throat or any difficulty swallowing?
A little bit.
Okay. Okay. Are you able to eat properly, to drink fluids? Mm-hmm. Good? All right, that's good. We want you to stay hydrated. And tell me a little bit about your nose. Have you noticed any nosebleeds recently?
No, not recently.
Okay. And is there anything coming out from your ears?
No.
Okay, so no discharge. Okay, let's go ahead and take your vital signs. Okay, just putting gloves on. And we'll measure your oxygenation first. Okay, this will go on your index finger. This will go under your tongue. I'm going to have you hold it with your right hand, okay? Great. Okay, oxygenation is 95% on room air. Heart rate is 84. .96% at room air. That's very good. Okay. Let's go ahead and check this. 99.3 Fahrenheit. It's a little bit elevated. Did you have anything to drink before coming in? Okay. And I'm going to take your blood pressure. Okay. I'm going to have you relax your arm. I know you mentioned that you're not having any nosebleeds, but with your headaches, I think it's a good idea to have a base of how your blood pressure measures. (118/70). That's normal. It's not too high and not too low either. Just going to slide this down. Let's go ahead and listen to your heart. Okay, it's gonna feel a little bit cold. I can hear only S1 and S2. No S3, no S4. I'm going to listen with the bell. Go ahead and take a deep breath in and hold it for 1, 2, and 3. Breathe out. Okay. Go ahead and take a full breath in and exhale. Good. And again, take a full breath in and exhale. Okay. I'm going to listen to the sides as well. Just going to lift your right arm a little bit higher. Okay. Take a deep breath in and breathe out. And the other side. Take a deep breath in and breathe out. Good. I'm just going to have you turn and I'll listen to your back. Is that okay?
Mm-hmm.
Okay. Okay, take another deep breath in and full exhale. Again. Full exhale. And again. Full exhale. One more time. Okay, very normal breath sounds. Just stay right there. I'm going to percuss. Very good. I'm going to take a look inside your ears first. Go ahead and turn your head that way for me. I'm going to have you relax. Let me know if you feel any kind of pain as I'm doing this. Just taking a look to see if there is any redness around the tragus. Okay, go ahead and turn your head a little bit that way. Okay. You might feel a little bit of pressure. The ear canal does look inflamed. I'm not noticing any infection. Tympanic membrane is broad-gray. Just a little bit of irritation. Some fluid buildup. Okay, let's go ahead and take a look at the other ear. Any pain with this ear does seem to be a little bit more red. Okay, so go ahead and turn your head a little bit more that way. Not seeing any infection on the left side. Just some constriction of the canal. Okay. I'm going to perform an ear test. I want to see how good your hearing is. Go ahead and close your eyes. Tell me when the sound stops.
It stopped.
Again, tell me when it stops.
It stopped.
Okay. Now go ahead and tell me which position here is louder, 1 or 2. I'm going to have you keep your eyes closed. So this is 1 and 2.
2.
And this is 1, 2.
2.
This is 1, 2.
1.
1, 2.
1.
Okay, go ahead and tell me when you don't feel the vibration anymore.
I don't feel it. I don't feel it.
Go ahead and keep your eyes closed. Okay, I'm going to try a different frequency. I did notice a little bit of delay on the left side, and that's the affected ear. So just trying to see if you have the same difficulty here, okay? Go ahead and tell me when you don't feel the vibration anymore. Okay, good. Okay, turn your head just a tiny bit this way. Good. Okay. Going to take a look at your mouth. Is that okay? Mm-hmm. All right. So we're looking for any swollen lymph nodes, swollen tongue or anything abnormal around the cheeks, okay? I'm gonna have you say a big ah. Okay, the soft palate looks intact. I'm not seeing anything swollen. Tongue looks symmetric. Okay, just gonna lift it up a little bit to see if there is anything under. Salivary glands are normal. Okay, go ahead and give me a big smile and frown above your cheeks. I'm gonna have you keep them puffed. Don't let me unpuff them. Very good. Go ahead and relax. I have here a few tastes since we are checking your throat. I feel like we should definitely do a test and see if your taste is abnormal or affected. What does that taste like?
Not good.
Okay. Is that salty, bitter?
Bitter.
Bitter. And would you say you would associate it with almonds or strawberries?
The first one.
Okay. Okay, let's go ahead and try that one more time. I'm going to have you close your eyes. What does that taste like?
Oh, salty.
Salty. Would you say that you associate it with pretzels or bananas?
Pretzels.
Okay. One more time.
It was sweet.
Okay. Would you say that you associate it with coffee or cinnamon?
Cinnamon.
Okay. Let's go ahead and check the patency of your nose first. So you did say that you're having some stuffiness, right? On both ears or just one?
Both, but mostly this side.
Okay. So the left side, that could be the sinuses. Is it okay if I palpate your sinuses first? Okay, I'm palpating the part that doesn't look as red or inflamed. Let's just see if there's any difference. Tiny bit of puffiness there. Definitely more red over here. Okay, there's another set of sinuses right in between your eyebrows. I'm just gonna go ahead and fill that as well. Okay, I'm going to palpate on your eye as well, very gentle. Let me know if you feel pressure more on the left or right or both sides. Okay. All right. I'm going to cover one nostril. Go ahead and try to breathe in, breathe out through the other one. Okay. Okay. Let's take a look inside. Go ahead and look up for me. I'm not noticing any obstruction, but there are some glands inside your nose that are a little bit inflamed. We're just going to keep on investigating and see exactly what could be the cause. Let's try and see if your sense of smell, so your olfactory nerve, is damaged. You didn't have any accidents, correct? Any broken nose, and you are not into contact sports or something like that. Okay, so these smells might be kind of strong. Wait. There you go. If they bother you or they give you headaches, just let me know, okay? Okay, go ahead and close your eyes. And just gently waving the test tube around your nose. When you're ready, go ahead and tell me what this smells like.
It smells like mint.
Mint. Okay. I'm going to keep this one a little bit farther from your nose. Let me know if you can detect it.
It kind of smells like cinnamon.
Okay. Definitely, that was garlic, and then it was very strong, so that was one of the reasons why I didn't keep it so close to your nose.
Okay, that one smells more like cinnamon.
Okay, and this is floral. Sometimes it could happen that we're smelling something that is not there. It could indicate a nerve damage.
It smells like mint.
Okay. And one last one.
It smells like ginger.
Okay. I'm gonna have you change into a gown, and I'll have you lay down on the table, and I'll take a look at your neck and throat and to see if there is any other damage that we haven't discovered yet.
Okay.
Okay, Nicole, I'm going to palpate first your lymph nodes. Let me know if you experience any kind of pain as I'm doing that. We're checking lymph nodes that surround the neck muscles, including cervical and thoracic. Sometimes throat discomfort could also come from an impinged nerve or a muscle that is swollen. Just gonna turn your head towards the right. checking lymph nodes that are above the collarbone. Is it okay if I open the gown a little bit on the side? Okay, checking the left posterior side of your thyroid gland. It's part of the throat exam, and we are expecting for it to be non-palpable. As you turn your head towards the right, I do feel a little bit of a lump, but that's because of how you turned your neck, so that's normal. And I'm not feeling any nodules, which means that the thyroid gland is normal size. Okay, I'm gonna have you turn towards your left now. I'm going to open the gown on the right side. Any enlarged lymphadenopathy above the right clavicle. Go ahead and turn your head towards the center. Just going to palpate your trachea now. Trachea is midline. I'm not sensing any obstruction. There's no inflammation around it. Okay, checking thyroid from the anterior side. I'm not feeling any lumps, and it's very hard to palpate, so that's good. Can you go ahead and swallow for me? Okay, very good. Checking preauricular lymph nodes in front of the ears and postauricular lymph nodes. The tissue is soft. I'm not feeling any bubble-like sensation. I'm going to palpate your head. Feeling for any asymmetry, lumps or bumps. Okay, I'm just turning towards the other side now to check the right occipitus. Okay. Palpating TMJ to see if I feel any inflammation around it. Moving that to the temporomandibular muscles that connect the jaw to the ear and cranium. So you're going to feel my fingers right under your eyes. Did you feel that equally on both sides?
Mm-hmm.
Did you feel that equally as well? Okay.
It was a bit harder on the right side.
Okay. Let's check that with too. looking for any abnormal muscle movement. Go ahead and open your mouth slowly all the way, as much as you can. And now close it slowly. Okay. I'm just going to move my fingers to a different point pressure. Go ahead and do that one more time. A little bit of anterior movement on the left side. I did not hear any popping. Let's do that one more time. Okay. Now I'm going to have you open and try to move the jaw towards the right. Okay. Come back to center. And let's do that one more time and move to the left. And come back to center. Okay, did you have any pain while you were doing that? Okay. Okay, so I'm gonna give you 3 numbers: 1, 2, 3. 3 is the worst pain, 2 is so-so, 1 is very little pain. Go ahead and tell me if it's 1, 2, or 3. So I'm pushing down.
1. 1. 1. 2.
Okay. So these muscles are the ones that are affected. I'm going to touch you with 2 textures. One is going to feel dull. This is what dull is going to feel like. And the other one is going to be sharp. This is what sharp is going to feel like. Go ahead and tell me if you feel this sharp or dull.
Dull. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. 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 Dull. 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 Dull.
sharp, sharp, dull, dull, sharp, sharp, dull, sharp, 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 dull, sharp, sharp. Okay. Go ahead and tell me if you feel this on the left or right. Left, left, right, right, left, left, right, 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 left, 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 right, right. Okay. I'm gonna try to listen to your TMJ and see if I hear any microscopic sounds that can be picked up through the stethoscope only. Go ahead and try to open your jaw slowly. Okay, and close. And do that one more time. And close. One more time. And close. One more time. And close. Yeah, so just like I suspected, I did hear the cracking sounds, which are normal in your diagnosis. Let's go ahead and take some measurements. Okay, go ahead and open as much as you can. Okay, so that's 4.6. You can go ahead and close. What we can do today before we set you up with an orthodontist to try to fix the jawline, we can do a TMJ massage that really helps with inflammation and to subside the pain that you're having, especially in the back of your neck. The pain is coming from the front, and that's why you're experiencing some pain towards the left side, right under your eye here. So let's go ahead and start by applying an anti-inflammatory medication. It has 3 medications in it. One is anti-inflammatory, the other one is for pain relief, and the third is to increase circulation. Okay, warmed it up in my hands. Now I'm gonna go ahead and apply it. But just a little bit more. These are the pressure points that we're going to trigger to relieve pain. First, I'm using a lymphatic movement that helps to drain the liquid that is stagnant. Using a very gentle pressure. To apply acupressure. Let me know if you feel any kind of pain as I'm doing that, okay? We're trying to trigger the points that are very tight. applying gentle pressure. Okay, I'm going to go ahead and ask you to get dressed. Well, we will do another exam in about 2 weeks for follow-up to see how this looks. In the meanwhile, I'm going to set you up with a TMJ specialist who's going to help you to rebalance your jawline, and that's going to cause a little bit less pressure on the TMJ. Okay, I'm going to prescribe some medication to help with stress and as well with the pain that you were having. Do you have any questions for me?
No.
Okay, thank you, Nicole.
Thank you.